Hello, everyone, and thank you for checking us out. This is another episode of SAC Health Answers, the opportunity for us at SAC Health to answer your questions directly from you and our community and our patients regarding your health so that you can make positive decisions that impact your health and wellness. I'm Dr. Jason Lohr. Many of you may know me as the CEO here at SAC Health, but I'm also a practicing family medicine physician. And today, I want to share a question that I get commonly from patients because I run a travel medicine clinic as well here at SAC Health. So a common question is, if I'm going to travel, do I need to see a doctor for that? Especially if I'm going to go back and travel and maybe visit friends and family in another country. Well, I'll tell you that it's always best to bring up your travel plans with your primary care physician, regardless of where you're going in the world. And especially important if you're going to a country that actually has diseases that aren't common in the United States of America. For instance, if you're going to places within Africa or within Southeast Asia, those are locations that may actually have diseases that we're not used to in this country, including things like malaria, including things like other viral illnesses. And you may need vaccines, you may need a medication, you may need other treatment or preventive treatment that you may benefit from having that discussion with your primary care doctor. So as a travel medicine specialist as well, I always recommend talking to your doctor about that and getting any advice and any benefit that they could offer you before you travel. In fact, things like routine vaccines are extremely important because getting your flu shot, having all of your routine vaccines up to date are very important because you can be exposed to some of these diseases in other countries that, again, we don't see regularly here. Also, thinking about medications that you may need when you travel. There may be a need to prevent things like malaria, and that would be a medicine that you would take on a regular basis while you're traveling. Other things like traveler's diarrhea. That is a very common illness that strikes up to 30% of those who travel, regardless of what you do, regardless of how much you try to avoid all of the recommendations that are out there. 30% of travelers will still get traveler's diarrhea, and you will not enjoy having that when you're traveling. So having something available to take, medication already on hand, would be great, and your doctor can provide that. Again, lots of great information you can receive from your doctor before traveling, so make sure to make an appointment and talk to your doctor before you travel. Thank you so much for joining us for this episode of SAC Health Answers, and hope to see you next time. Take care.